And we are living it up with a special edition of Daytime Columbus today. Hi, everyone. I'm Robin Haynes. Now, we know that the last 2 years have been tough on our healthcare systems, right? And their employees. So today, we are highlighting a community hospital that's been working hard to adapt and innovate. So first up, a look at how Licking Memorial Health Systems handled their COVID response, while at the same time, updating the entire manner in which they handled patient information. Then a look at the many surgeries now being handled robotically and how smart beds are creating better outcomes for everyone in the hospital. This is Daytime Columbus featuring Licking Memorial Health Systems. All right, you've probably heard this quote before. You can't really know where you're going until you know where you've been. At Licking Memorial Health Systems, they learned a lot during the pandemic while looking forward to the future of medicine. In our first sponsored segment today, we get an inside look at what the last 2 years have been like inside LMHS. I want to bring in Rob Montagnes. He's the president and CEO of Licking Memorial Health Systems. We're also joined today by Sally Arnett, the VP of Information Systems. Thank you both for being here on Daytime.
Great to be here.
Glad to join you, Robin.
When we talk about the pandemic, Rob, nowhere really was more immediately impacted, right, than the healthcare system. So start us off today by sharing what the response was like at Licking Memorial.
Well, this could take our entire show, so I'll try and be brief. I'll start with our employees. I just am so proud of their resiliency, their dedication, just tremendous in meeting the needs of our community. Whether it's having one of the first drive-up testing clinics in all of Central Ohio, the outstanding vaccination efforts throughout the entire community, and the continued availability of testing kits, even as recently as a few months ago. Our employees, our entire organization really responded well during an unprecedented pandemic. So certainly very proud of all the work that they did. And it probably would surprise people that we did things other than deal with COVID over the last couple of years. And one of those very important, significant projects centered around implementing a new electronic health record, Epic. And while typically you would expect to go on site to Wisconsin, where Epic's headquarters are, to do a lot of training, almost everything had to be done virtually. So our employees, while dealing with a pandemic, stepped up, implemented a new electronic health record that is now benefiting our community and our patients. So Sally, maybe talk about the benefits of Epic and how that's helping us move forward.
Epic has been such a huge change for our clinical teams as well as our business units as well. It's one of those things that you change everything about how we do business in the organization, how we provide patient care. So it was an 18-month implementation that was really driven by the clinical teams. So even though we're talking about a computer information system, what we're really talking about is how do our clinical people get the information that they need to take care of our patients. With Epic, it really puts the information right at the fingertips of the clinical people who are providing care, and it's secure, and it's able to follow the patient through their entire journey with LMH.
Sally, why would you say Epic was needed? You know, why bring it now to Licking Memorial Health Systems?
Really, that eliminating those silos of data was one of our biggest factors. Trying to get a good perspective on the patient and their journey is one of the best things about Epic. We can also share data with other facilities, and we can see data from other facilities very readily. And most patients don't go to just one facility for their care throughout their entire lifetime. So as patients go through that journey from their physician to their office to maybe specialists or to LMH or to other facilities in the community in Central Ohio, we're actually able to share that data in a secure fashion so that each provider can see all the information that they need to take care of that patient.
Yeah, as a patient, I love the control and flexibility Epic MyChart provides to me, whether it's making appointments, paying bills. So maybe talk about some of the enhancements on the end user side for patients with MyChart and Epic.
One of the things I think, Rob, that's so great about this job is that I don't just get to implement the technology, but I actually get to use that as a patient. One of the things I absolutely love is the online scheduling. I also love the fact that a lot of times I have my results back before I'm actually even out the door from my visit. If I have questions, I can send a secure message to my provider. One of the things I think that's really exciting that we're doing is sharing the actual physician notes. We have a group that we work with called Open Notes, which actually allows the physician to write their personal notes as they're taking care of you and asking you questions and documenting that care that they're providing to you. We allow our patients to actually see those notes in real time. So as the physician finishes up your visit, you're going to get an email or a secure text telling you that your visit is done. And you can actually go right into the chart and see exactly what your physician said. And it answers a lot of your questions. So you don't have to have sort of that, you go home a lot of times and the visit's sort of overwhelming. And you think, wow, I'm not really sure I remember everything my provider told me. You can just open up your app, log into MyChart, and actually look through those notes and get all the information without having to remember it all. So I think that is a really great thing.
Yeah, so many great things. And we know the quick pandemic response, just the start of that, but you have worked to improve the lives of your patients. We're going to hear all about that throughout the next half hour of today's show. So Sally, thanks for kicking it off.
Thanks, Robin.
And Licking Memorial wasn't just reactive to the new COVID world, it was also proactive in implementing new procedures. Later in the show, we'll run through some of those innovative changes. And it may not get much more innovative than this, the future of surgery in the hands of Da Vinci. And today's Daytime is sponsored in its entirety by Licking Memorial Health Systems. And we are back now with our special edition of Daytime, focused on Licking Memorial Health Systems and the incredible ways they're innovating their patient care. Now, let's learn about their recent addition of the Da Vinci surgical robot. President and CEO of Licking Memorial Health Systems, Rob Montagne's back with me once again. And Rob, I want you to introduce us today to two of your doctors who are joining us.
Well, we're so fortunate to have outstanding physicians, the entire medical staff. We have Dr. Roy Brown and Dr. Brent Savage, two of our surgeons, to talk about our Da Vinci robot that we purchased just a few months ago.
And it sounds incredible. So I want you to kick it off, Rob. Start the discussion here. What are we talking about?
Well, they have great skills, but we always want to try and maximize or enhance their abilities. So Dr. Brown, Dr. Savage, how has the Da Vinci allowed you to be an even better surgeon?
Well, the robotic surgical system is a nice way for us to operate. It's a minimally invasive procedure that makes very small incisions, and thus patients need fewer stitches, less pain, quicker recovery. With the robotic surgery, we have a three-dimensional operative field that more precisely allows us to do these delicate fine-tune operations. And it also enhances our accuracy as we perform the surgery.
And Dr. Savage, how does the surgeon interact with the machine?
Well, we've been using laparoscopy for years, but the improvement with the robotics, as Dr. Brown put, allows us to have significantly more ergonomics. We begin the case as we would a regular laparoscopic procedure and set up the robotic arms with the instrumentation that we will be using for each individual case. And then we move to a set station that gives us the three-dimensional view and the hand controls that allow for us to use all of the instrumentation that the robot has.
I can tell you, Robin, I had a chance to try it out, and even I could use it, not to the same skill level, but it's very, very user-friendly. Dr. Brown, you talked a little bit about some of the benefits to the patient, but there may be others, and also talk about the application that really has expanded over the years from maybe just urology to all the various specialties that can now use the robot effectively.
Yes, that's true. I mean, so originally the robotic surgery was started off in the urology field, basically looking at robotic prostate removal because the prostate sits so down in the pelvis, it's difficult to do the operation. Over time, it's been expanded now for our gynecological colleagues. They do hysterectomies, myomectomies, small procedures. I think a few have done tubal reversals using the robot. We have the general surgeons like Dr. Savage doing hernia repairs, gallbladders, colon resections with this. We have some of the cardiothoracic surgeons doing operations to the heart bowel replacements. And so even if you have done bypass grafting, as far as what they call a CABG procedure with that. So it's made it very nice for the patient. Additionally, I think there are a few ENT surgeons that have done it for back of throat surgery for like oral cancers.
Dr. Savage, I want to quickly ask you, have patients then seen quicker recoveries from these? This probably benefits them afterwards, right?
Well, no question, the magnification and the utility of it allows for significantly decreased operative pain, which we have found in our postoperative scoring, getting back to life faster, smaller incisions, but also less tissue trauma on the inside, less healing that has to happen, frankly.
Okay, so there you go. Thank you so much, doctors, for sharing your expertise with us today on the Da Vinci surgical robot. It's been a pleasure.
Thank you.
And up next, even the hospital beds work hard at Licking Memorial. See how the information gathered through their smart beds can lead to better patient outcomes. And the commitment to better health extends well beyond the hospital walls, so we'll also look at some of the outreach programs just ahead on this special daytime, which is sponsored again in its entirety by Licking Memorial Health Systems. Well, how many times have you or a loved one had to spend a night in a hospital bed and perhaps suffered through a rough night of sleep? Total patient care isn't just about the medical treatment. It's also about advanced technology, your safety, and even your comfort. And it's why Licking Memorial Health Systems is proud to offer smart bed technology. Rob Montagni's president and CEO of Licking Memorial Health Systems is back alongside me once again. We are joined now by Kim Hedelson. She's the director of cardiac services and acute care. Kim, thanks for being with us.
Thank you, Robin.
All right, I want to start with Rob here because I know technology is always changing, especially in the hospital system. You're always looking really for worthy advances, right, for your patients. So why focus on smart beds?
We look at every technology that we feel will make our patients' care obviously better and their experience more safe. And the early sense technology, and now it's in the bed itself with the smart bed, allows us, we feel, to give our clinicians the best tools to give the best care. And so simply, we know we need to make those investments when they present themselves. And so the new beds with the early sense technology are really something we are committed to. So maybe Kim, talk about the benefits. And you're a nurse. What does this allow the nurse, the clinicians, in terms of the care they provide to the patients? What does it allow them to do better?
So the smart beds themselves, they increase the patient safety through fall preventions and pressure injury prevention technology. And from a fall prevention technology, the beds are able to detect any movements or weight distributions of the patient. So if a patient's trying to climb out of bed or able to get out of bed, it's going to identify we've already identified their fall risk, so it's going to contact the nurses and the patient care technicians, and it'll alert them to go to the room to check on the patient. So it also gives a verbal prompt to remind the patients to please stay in bed and that somebody will be in there shortly, so they are not trying to get out of bed independently when they are a fall risk. At the foot of the bed, what's really a nice feature is that at a glance, when I'm walking by the room, I can see lights that are projected on the floor that indicate that everything is green, meaning that the bed is in low position, that all my alarms are set, bed exit alarms on, and maybe that continuous monitoring that you're talking about with early sense is on and in use. So that's a nice visual for the clinicians that are taking care of the patients.
Kim, would you say that the benefits to the patients are kind of right hand in hand with what that is giving to the clinician, or do the patients benefit in other ways?
No, I believe it's both. Like you said, having the technology that's going to prompt notifications when there's a safety risk, I think that's both a benefit to the patient and the nurse and the point of care testing technician. So I think it's, a benefit to both.
Another component of the bed that some don't always appreciate is the Hercules component. And we know that a lot of clinical folks can get injuries from trying to reposition or move patients. So maybe describe the Hercules component and how that's helpful.
Yeah, the Hercules system it utilizes a specialized sheet that lays over top of the Centrella smart beds. And it has a drive at the head of the bed that helps the patient being pulled up in bed. So often the patients will slide down in bed, and obviously we're wanting to turn them pretty frequently to minimize any pressure injury prevention. So at a click of a button, we're able to pull the patients up in bed. The nurse can go in there. It might only take one person to go in, press a button, and it pulls the patient up in bed. What's also nice about that feature is the patient is moving with the sheet, that specialized sheet. And so it decreases the friction and helps preserve skin integrity of that patient. And as you mentioned, Rob, that it reduces staff's injuries, and being able to pull up a patient in bed with one person obviously increases the workflow efficiencies.
Yet another look at the latest technology, making hospital stays easier, making it more comfortable for the patients. So thank you so much for that look today, Kim, and thank you for joining us.
All right, thank you.
Well, making smart choices for the hospital is not just about the patients, it's also for the staff, even if it seems as simple as a modernized cafe. And today's Daytime Columbus again sponsored in its entirety by Licking Memorial Health Systems. I'm back now with Rob Montagnes, he's of course the CEO and president of Licking Memorial Health Systems, for a segment we like to call Fast Facts. We get a lot of information during this last segment, and it's Rob's chance really to kind of brag about his team a bit. They deserve it, and I know, Rob, that you love that, right?
Hey, this is my favorite part.
All right, so let's expand first on the technology that we discussed earlier in the show, and this was on the smart beds and this early sense technology.
Yes, early sense is a technology we've had for years, but it's now a part of the smart bed, but it's still a very important technology that comes with the new beds we installed throughout the entire organization. And this technology continuously monitors respiratory rate and heart rate. So it really allows us to intervene if a patient starts to have any issues very early on in the care process.
Let's talk now about some of the newer projects, and one in particular that was sparked by the new needs of the COVID-19 pandemic.
No question. I think every health facility was trying to find ways to get results as to whether folks had COVID or some other virus. And our laboratory did an outstanding job of getting additional equipment that allowed us to do a lot more testing and the results to be back very, very quick so that we could assess whether or not folks had COVID, needed to be in a COVID unit, or perhaps had some other virus, and we could treat that. In addition to that, we acquired more ventilators, and that was obviously a need with some of the challenges folks had with their respiratory issues because of COVID. So new equipment, but I think it just shows our ability to respond quickly to the needs of our community.
During the last 2 years, you also transformed your Main Street Cafe. What was the inspiration for this, Rob?
Our employees are obviously our most important asset and resource, and making sure they have an area and an opportunity to recharge their batteries, if you will, working a 12-hour shift. So our ability to redo our cafe, offer some great new options in terms of healthy eating in a very comfortable setting. We have a live wall, an environmentally friendly option for getting food and taking it home. So the enhancement in the cafeteria was really an investment not only in our facility, but really in our employees, and making sure they had great opportunities to once again recharge that battery.
I know you're pretty proud of another renovation, and that's in your physical rehabilitation facility.
Yeah, you know, as a byproduct of COVID, but just really with a lot of treatment, you need to rehabilitate occupational therapy, physical therapy, and our new facility is just outstanding, but it's got a nice track inside. The physical therapist could use that, as well as a number of other new physical therapy technologies that really enhance our community's ability to get rehabilitated and get back out there and exercise.
Tell me now about the Education Center, and this one really for your staff and their development.
Yeah, another investment in our staff. We have to make sure that we continue to enhance their education, any training that needs to be done as the clinical processes evolve, and we have a new education center with the latest simulation mannequins that allow us to do really state-of-the-art training and keep their skills at the very best. And this was implemented over the last couple of years and obviously proved very useful during the pandemic.
And as a community hospital, Rob, it has always been vital for you to focus on community programming. That did not go away.
Yeah, one of the bigger challenges during the pandemic is we wanted to do so many of our traditional programs, and we were able to, during the lulls, continue with those. Some of those we had to do virtually, or some of those we had to cancel, but we were able to do many of our Active Fit programs, both for Active Fit Senior and Active Fit for the youth. So we added a yoga class for the active seniors that's been very well received. We were able last summer during the lull to do a lot of our active youth camps like Camp Feelin' Fine, Camp Courage. So I think our continued focus on community health and wellness did not subside during the pandemic. We had to be creative, but we continued with it and are looking forward now that we're in another lull to a really robust summer for community activities.
Absolutely. You know, today, Rob, has been such an enlightening experience. It is educational always to speak with you about what's going on at Licking Memorial Health Systems and really how dedicated you are to the community and to your healthcare providers.
Well, I always appreciate the opportunity to share the great work of our outstanding employees and medical staff and the overall work the organization does. So thank you for having me and allowing me to talk about Licking Memorial Health Systems.
It's been a pleasure. Thanks as always, Rob.
Thank you.
All right, I want to thank the entire team at Licking Memorial Health Systems for sharing all the good they're doing in our community and for sponsoring this full episode of Daytime Columbus.